Hello friends, hi, this is Dr. Shonali Chandra. In this video, we're going to talk about how to deal with clinical subjects, how to read clinical subjects. And for that, understand here that we're talking about learning new material. Now, just like a building has a foundation, and how strong the building is, how long it will last, will depend upon the strength of its foundation. Similarly, for clinical subjects, the core, the foundational subjects like anatomy, physiology, pathology, biochemistry, pharmacology, these building blocks have to be strengthened first. So when you read clinical topics in medicine, always go back to answering basic questions first as to why a particular thing happens, how that happens, when does it happen, what do we already know about it, because there is always a foundation of prior knowledge, and then new information we keep on adding to what we already know. So each time we're tackling a clinical concept, we need to go back to the basics to build on our long-term memory structures. So how do we go about starting on a new topic? Well, to begin with, that could be any clinical topic which you want to read on. Let's say, for example, you're reading medicine and you're reading about anemia and its clinical management. So begin with what you already know about anemia. I mean, you've read anemia in your first year, second year pathology as well, right? Then you read the material that is in front of you, the clinical textbook that you have. At the end of your thorough reading, the first reading should be a thorough reading. Summarize in your own words what you understood of that topic. While you are making that summary, right, at that point in time, there will be things that you have forgotten. You will realize that there are certain concepts which you studied in your first year and second year, but now they are hazy and you've probably forgotten, or they're not as clear as they should be. Then go back to your basics and each time try to learn with clinical scenarios. Yes, it will slow you down the first time. Such sort of thorough reading is going to take time. But when you stay at it long enough, eventually you will see that it works. So when you're doing that first time thorough reading, the next question that arises is making notes. I mean, I often get asked by my students, should I be making my own notes? And I always reply to them, yes, indeed, you should be making your own notes. Is notes equivalent to material? Is notes equivalent to the textbook? No, it is not. You can get the pre-cooked notes as well. I mean, how many of you have actually, gone ahead and read through other people's notes or notes written by the other people? Like in our college days, we had the toppers notes, toppers who used to make their own notes. And if you try reading other people's notes or notes that other people have created, it becomes a very difficult task. It just keeps adding to your effort. So you have to make the first time effort of reading thoroughly and making your own notes. Now, the notes are not equivalent to material. It is only important for you to help revise at a later point in time. Now, the notes that you make could be in the form of flashcards, they could be in the form of diagrams and flow charts. The more you're going to make the effort of making your own notes, the more the concepts are going to get clear to you. So let's talk about flashcards for instance. I mean, these are a memory tool which comes in very handy for revision at odd times, like for example, over a coffee break. You have a flashcard in front of you with a question on one side and the answer to it on the other side. And you can preferably should be making your own flashcards, and you can use them to constantly quiz yourself, because the effort that you will make each time to recall an answer, not just plainly reading the question and reading the answer, but the effort made to recall the answer is what is going to help you consolidate your memory. Another place that students get stuck is with dealing with clinical scenarios, like especially when there is a differential diagnosis sort of an approach where a patient comes with a clinical complaint and you have to arrive at the diagnosis, and to arrive at the diagnosis you first need to have a differential diagnosis in place. Now the key to mastering the differential diagnosis approach is that each DD is actually a separate chunk of information. Like, let's say, for example, a woman comes with the complaint of abnormal uterine bleeding. I mean, it could be because of pregnancy complications. It could be because of fibroids or polyps or adenomyosis. It could be because of a variety of other reasons like coagulation disorder, ovulatory disorders, endometrial causes. Now, each of these causes is actually a separate topic in itself. So if you think, then you can start your clinical understanding by simply reading about abnormal uterine bleeding first. That's a wrong approach. You should first individually read each and every differential diagnosis and then, consolidate it all together. That is, a woman comes with abnormal uterine bleeding. These are the possible differential diagnosis. And then, how should we go about eliminating each of those? Therefore, please remember, first have your separate chunks of information in place and then consolidate it all together. That is how you will be able to master the various clinical scenarios. For that, you will have to train your brain. Yes. You will have to discuss the clinical scenarios maybe with a group of friends, with your teachers. You will have to work around a differential diagnosis. This approach is the best way to master clinical subjects. So your goal should be learning. Your goal should be strengthening your concepts, building blocks of information which at a later point in time you can recall. Once you do this, your performance in any test or simply while seeing patients in the OPD will actually improve. Having said that, there is absolutely no dearth of clinical information. There is much to learn. There is a lot of information that we need to memorize and retain. There is not one clinical subjects, but for our examinations we have 19 subjects that we have to master. So if you follow this approach of how to read clinical subjects, every time each topic will become easier and easier. However, yes, the first time effort will be there. And at the end of it all, please remember, take a good night's sleep, take a break. That is equally important. As medical practitioners, we should be aware that sleep is something that consolidates our memory. Sleep is something when the brain is resting, the synapses are developing, and our long-term memory gets consolidated. So an overnighter can work. And it does work, and we've all done that, cramming in the middle of the night, cramming through the whole night and then appearing for an examination the very next day. And yes, we're able to, vomit everything out on the examination sheet, but a couple of days later, it's all gone. And when you have 19 subjects to prepare and appear for in an examination, such kind of tactics will not work. You have to focus on achieving long-term memory. And take a good night's sleep, take a break. And even if you're not able to do that, taking power naps in between are equally effective. And, try following this regime, try following this routine of how to effectively read. Persist at it, stay at it. You will see a difference in how you consolidate your concepts.